All right. While everyone's coming in, I just want to welcome everyone to today's webinar with Catalyst. And before we get started, I would just like to touch upon a few housekeeping items. As with all of our companies, when we host our webinars, Catalyst is actively fundraising right now on Netcapital. You can you can invest in the company by visiting netcapital.com and searching Catalyst if you are interested in doing so. And for those who are viewing right now, I'm going to drop their investment link in the chat. And let me enable to everyone. And there we go. Next, I want to mention that we do want this webinar to be as interactive as possible. So please, when asking questions, use the Q&A function and not the chat that I dropped the investment link. It just helps me stay a little bit more organized, and we will do our best to cover many of them on this session. And I know there are a lot of investors joining right now, and I'm looking at the name list that have previously invested in Catalyst, but I also see a few new names and those who have not done so just yet. We will do our best to cover both sides of the aisle. And with that being said, it's my absolute pleasure to introduce Catalyst President and CEO Jit, as well as Catalyst Advisors Steve and Jerry. Gentlemen, how are you today?
We're doing fantastic. Thanks, Tom, for this great opportunity to give us to talk about Catailyst and our experience and how we're putting together this data platform for changing a lot of different data accessing possibilities.
No, absolutely, Jit. And before we start, I want to thank you as well as you, Steve, and you, Jerry. I know how busy you guys are. So parsing out 45 minutes to an hour to really dive into, who the leadership in the company is. We're going to be talking about how the company was founded, where's it going. And with that, just to kind of start us off, Jit, could you just give us a brief overview of the business?
Yeah, so what we do, we collect information in the life science industry. And the challenge in the life science industry is there's too much data, and a lot of these data are unstructured. So traditionally, what other companies will do, the data aggregator, they manually input information. And we're changing that with the help of extractive AI. We are putting automation, and we know how to get those data get structured, and we're making it easy for the users to access this information. That's the very high level thing we do.
Chit, thank you. And when I first met you, it was you and then Steve. You were on the coming calls, and I was just so impressed with the team. Folks like you, Jerry, and Chit, the people that you've put around you that in your network. And this is just a personal opinion, but I believe when folks look at investing, they invest. The company needs to be great, and they need to believe in where the company's going, but they also invest in the people who are leading it. So I would definitely and absolutely appreciate if you could dive in on the team. And gentlemen, if each of you could kind of introduce yourselves, talk about your background, because you guys have built a very robust team for the business, and I think it's important for people to know that.
Yeah, I think I will go last. I will give Steve and Jerry to talk about themselves first. I cannot appreciate them having on the team. And the reason I want to go last, because I have to talk about a few other members who are not present here. We recently had a partnership with Launch Adventure. One of my acquaintances from high school, he's part of the journey as well. So I'll let Steve and Jerry talk first, then I'll introduce myself and talk about my other great partners.
Hi, this is Steve Gullins. As you can tell from the skyline, I live in Boston, not too far from JIT. With just one general comment first. Jerry and I and all the people who have helped JIT build this platform in various ways are experienced veterans in the life science industry, all the way from discovery of new drugs to actually launching products into the space. And we've all joined this mission because we see the power of this technology, and we've lived for 30 years of frustration of trying to download everything from the internet, unable to, building spreadsheet after spreadsheet, and it's been a challenge. And every time a new project comes up, you go back to the drawing board. This is something new. I began my career as a Harvard professor, doing development of many technologies. I then ran a couple of biotech companies myself and became a venture capitalist. And for the last, I've run a public company, a biotech company. And for the last few years, I've been advising a half dozen companies, including this company, very closely. And the reason I'm so enthralled with JIT and the company is they've automated things that we used to have teams of people, and most companies still do, trying to find answers to very nuanced questions. Whether you're investing in a new technology, you want to know who the competitors are or how people failed before, or you want to know the M&A, or if you're actually helping design clinical trials, just understanding that landscape. So the kinds of questions you can ask and get answers instantly are a refreshing new outlook for what AI and large data approaches have brought to us. And so I'm on the platform all the time and really helping. Jerry and I and others have actually shaped the kinds of questions that can be queried instantly. And so as practitioners in the industry who understand what we're doing, and we're both big fans. And I'll turn it to Jerry now.
Sure. My name is Jerry Cox. I'm a physician scientist. I'm on the faculty of Harvard Med School, and I'm a staff physician in clinical genetics at Boston Children's Hospital, both on a part-time basis. My real passion has been drug development in rare diseases for the past approximately 25 years. A lot of that time spent at Genzyme and then Editas Medicine, and more recently consulting for small biotech companies. And Jit and I have known each other for over 10 years. And when he approached me a couple of years ago about this platform, it was perfect timing for me, because as a consultant, I have to manually go through all the different information at hand to try to provide my clients with the best opinions going forward. What disease indications, what drug targets, what's the competition like? It's very laborious to do that. And I can speak to that personally as a consultant, and to have that automated, using AI and automation, be able to get that information at my fingertips in a very short time period is very instructful for me to make recommendations how to go forward with different programs. So I am a total believer in it, and I've used it firsthand, and it certainly simplifies my life and frees me up to do other things that are important as well. So I think there's going to be a lot of value in this platform. I think it can only grow and become better and better over time. So I'm really excited to be part of it.
Thanks, Jerry. I'm going to talk about my two other partners first. We have several other advisors. We have Amita Soni, who has a lot of marketing expertise. We also have Mark Benjamin. We have Thaminda Ramanayake, and they are all industry experts, industry veterans. They exactly know what type of information we're looking for. So a lot of backbone work went inside, even we put into automation, was discussions with them. I want to recognize that for their help over the years. In addition to that, in this journey, we are partnered with a company called Zelpmock. And I don't think we could be here where we are without the help of Zelpmock. My high school friend Sandipan and I started talking about a company in 2017. And I'll talk about my background in a minute, but in 2019, when I was leaving Shire Takeda, I called him up and asked him, if I ever had to do a company, when should I do it? His answer was right now. And I dropped everything, corporate job, and started Catailyst. That's 2019, April. Talking about my background, I'm a scientist by training. I lived all this information in different ways. First, I was a medicinal chemist at Pfizer. Before that, I had my PhD postdoc in organic chemistry. Later, I moved into transactional role. I was a FIN-registered banker. Later, I was a corporate development at Shire Takeda. I breezed that with an MBA from UConn. Sandipan is a lifelong entrepreneur, and he has been founding company since we left high school. Right after his undergraduate, he went in software developments, and he had many successful exits, and having him as a partner in this journey is just tremendous. And lastly, I also want to mention about Launch It Venture. We just partnered with them several months ago. We have been talking for more than a year, and Steve can talk about it a lot. He knows Justin, who is part of our team as well, very well. And he has expertise of this industry um, for over a decade. And he's coming in and spearheading all our marketing efforts. We're still doing a soft launch. It's taking us a little bit of time to get off the ground, but it's a tremendous team. We have it together.
Jit, Steve, and Jerry, really appreciate that. And Jit, thank you for providing color on the folks that aren't on this webinar, because I think, you know, it's so important with the dynamics of the group and the team that you formed. And Steve and Jerry, your experience, and Jit, you're from academia to vision, and how everything got created to where you are today. It's fascinating. That's really what stuck out to me from day one. So really appreciate you diving into that. And then, okay, kind of getting into the nuts and bolts of the business. Jit, if you want to answer this, or Steve or Jerry, can you just talk about what the problem in the industry and getting granular on what the business is trying to solve? I know we touched upon it a little bit in different areas, and why some folks have joined, but just break it out in its entirety.
Sure, absolutely. I think Steve and Jerry both touched on it. First of all, there's lots of data in the life science industry. It's a regulated industry, so FDA, clinicaltrials.gov, SEC, they are always releasing information about these companies. Lot of this data are unstructured. So what the point Steve was talking about earlier, to get the data from unstructured to structured, we always use human labor. So somebody in the back office reading something and entering manually, it takes a lot of time. As they spend a lot of time, it becomes expensive. So these databases are not fully integrated, it's expensive, and it takes a long time to get the accurate data. So that's the major problem we are trying to solve, that making this data seamlessly accessible to the users who are trying to discover a drug, not to find the information where it resides. And the other important part of it is having this data in a single integrated platform. Currently, industry will subscribe to 3-4 different data vendors because everybody is collecting those manually. So it takes a lot of time, even after getting those data, putting in their own system to understand and comprehend what's going on in the industry. That's kind of in a high level. Steve and JD, if you want to add anything to that.
I had a quick comment. When I reach out to friends who are in the industry, I talked to one friend who's at a very major pharma as the chief medical officer, and I said, here's a great technology. I'm using it to finance it. I gave him some examples in his own field. And I said, would you use it? And he said, I don't think so, because I have 9 full-time employees that do what you just told me. And I know even if I had 9 employees, if I gave one of the questions, it would take 2 or 3 days to get the answer. So he's not anxious to let people out of work. So the largest companies now spend multiple millions of dollars for do everything that is done by hand. There are vendors who, the largest one in our industry, to compete with us head to head, where our partner Justin came from. They have 11,000 employees. So their minimum price tag to license their product at a company is $1 million. So that's not, and that's just for a few seats. There's not an awful lot of market available to us of all the smaller companies that just don't have budgets like that. And with the automation, not only is it easier, we actually get real-time results. So if a new 8K comes out or in a public company, it's in your inbox immediately of what's going on because you put an alert on that. There's a lot of exciting opportunities around this technology.
Yeah, I was
Yeah,
going to make a similar point that, to manually curate information is very time intensive and, as Jet said, labor intensive, and that costs money. Having a computer do it for you in, a second is very low cost. So, we think there's an opportunity to disrupt the market, by using technology to our advantage. And, there's a lot of people in my position, consultants, small biotech companies that just don't have the resources to pay for huge databases that are coming at a high cost. So I think there's definitely a market here for a very cost efficient access to data.
The other comment I would make is there's actually two major silos that this technology is addressing. One silo is the financial information. Bloomberg does a good job of that. They're not very savvy about the drug industry. They don't know every name of every statin, for example, traditional and everything else, whereas our platform does. But they could never tell you about anything in drug trials or targets in the pharma. And by the same token, there are clinical vendors who will sell you the clinical data, but you can't find out which indications should we go after, as Jerry was saying, because you can't see what the M&A value was of rheumatoid arthritis or of any other autoimmune disease in the same data set. You have to go out to another database to look at it. So when you put those two together in combination, you actually have a way to piece together the best opportunities from a business perspective.
I think I just want to add on top of that, it's not just automation. It's not just being able to put those data to some computer. It's our extractive AI, what you have developed over the last, I would say last 4 years. 3 years of that were in stealth. And we have some special capabilities of reading through lines and doing human equivalent work. So what the back office job, we converted that to fully automated extractive AI. And that's why we are in a very advantageous position, even in this era when everybody's waking up to generative AI and everybody wants to plug in a generative AI in their system. All the consulting company rebranding them as a artificial intelligence company, but we're not. We started thinking about artificial intelligence 4 years ago. We'll be probably layering some generative AI on top of it, but reliability of the data, source of the data is the number one important thing. Where did it come from? Does it really exist? All those evidential data, we create evidential data point at Catailyst, and that's very, very valuable. I want to add one last thing. Even if somebody finds data, after finding the data, they spend half a day looking for the reference. Where did the data come from? It's like a wild goose chase. Somebody says a company paid $50 million for an upfront payment. Now you're looking through all these documents. Where did the number come from? We make sure those data points are preserved and accessible at the right way.
Jet, really appreciate the clarity on that. And we just got 2 questions in. Can you just dive in and on what you think of the effect of generative AI is, and just, kind of explain that, because it's become a hot topic. The news just seemed to pick it up maybe 6-8 months ago, and then you hear about it. But can you just dive into that for a moment?
Sure. So I think I want to lay the difference between the extractive AI and generative AI first. So generative AI, what it does, it creates new information based on the pattern recognitions of lots of previously entered data. So I heard from a CEO of a company during the bio last week that she was looking for a mitochondrial disease, a reference, and generative AI actually answered its science citation for a particular volume, and that particular reference did not exist. It looked like the right answer. Extractive AI is more rely on training data, training of patterns. So with the existing information and guidance, NLP, we make sure what we're pulling is existent in a particular text. and then we summarize that, what that text means. So it's always evidential. Thinking about the effect, long-term effect, we will be looking into um, the generative AI for certain applications, but we have a very robust extractive AI for some of the applications. We do not need to change that. So I think cumulatively we'll benefit from the generative AI, but we do not see any immediate threat for us because the robustness we have generated over the years, it's not going to be replaced overnight. There have been a lot of trial and error to get where we are today. Um, just like doing a scientific research, we did 2 years of research to find out what works, what doesn't work. So somebody cannot just come in overnight and say, okay, I'm going to use generative AI and we're going to generate the equivalent data. It's not going to be easy.
Yeah. No, Jen, really appreciate the color on that, and explaining that. And so just pivoting into the next question, just with trends in the market, can you provide further context on your opinion, what you're seeing? Again, this is AI, and um, it seems to be a buzzword that's in the news every single day. So from your perspective, can you talk about some of the trends?
Yeah, so I was at the Bio IT conference, and one of the trend in the life science industry I saw, everybody wants to do a mapping of the connectivity. So there will be ontologies of a particular word, and they're trying to find the map where it is. And there's probably 5 or 6 different companies were trying to do the similar things. That's one of the things observing a lot. Lot of ongoing efforts to layering generative AI. Generative AI is not new. It's been around for many years. We did have an internal. Steve and Jerry can talk about it as well. They're present. We had an internal review with an expert who is currently works at AWS, and also our chief technology officer Sandipan, to understand how is it going to affect us. And what do you re-emphasize that our methods are very robust, and we'll also explore certain types of generative AI. Steve, do you want to comment on that, or Jerry, anything on the trends? What you're saying as well?
One is the generative AI. Everybody's aware that it doesn't deal with numbers, doesn't have common sense. There are certain things it's getting completely wrong. That will diminish over time. But right now, the reality is you can't use it. For example, would you actually use the results of a ChatGPT analysis to submit something to the FDA? Of course not. If you're an analyst on Wall Street, are you going to use ChatGPT to determine which biotech stock to buy this quarter? Of course not, because you know that it's unreliable information. And so we start with highly reliable information to begin with, and then we add the AI to actually find the patterns that are within it. But over time, we're obviously as aware of the AI space, the generative AI, we will integrate it, but we will always have this filter where it has to be quality into our system. And if that quality is coming from the large language models, fine. But we're going to have a filtering system that applies that. And so that's what we're exploring in the near term, is how to combine the two, but have a highly qualified referenceable data set you would always use with the FDA, and then some other stuff that you can use to say ask what if questions, or maybe to repopulate some missing facts as we go along. But it's going to be a long time before generative AI is truly passing muster in terms of high quality results. Every time.
It really is fascinating, and especially learning about, and Jed, I think you alluded to a little bit, a few years ago, the inception of the business, but your experience and where you saw the market going and where it is today. The company's poised to make a big splash, and I think it's interesting. We got 2 questions in, just talking about how big is the market for your business, kind of where you sit. We know it's big, but how big?
Right. I think we are subset of the healthcare analytics market, which is also subset of life science analytics market. What they're predicting by 2027, life science analytics markets close to be $47 billion. Our ground up approach for our current target market is close to $1 billion. I want to emphasize on one fact here, which is not probably not clear to everybody what we are selling as products now and what we can sell as product in future. We are just selling, if you think about, we are not Amazon, we are not Apple, but I want to give you a contextual similarities here so that you can understand and relate to it. When iPod first came out, everybody thought there was just iPod, one product. But now if you look at it, you have Apple Watch, iPad, iPod, iPad Nano, all different types of products. We're kind of set with very similar with one types of data analytics to start with. It's like Amazon back in the day selling books in the internet. So I want to take you as an analogy with like that we have opportunity to do clinical trials analytics, predictive analytics, stock market analytics. All these things are coming, reports, a la carte reports. Timing of it, we cannot promise on that, but if things goes right, it's not going to be too far. So I just want to keep that context of it when you're looking at this market. But our current market is close to $1 billion. Jay, do you want to talk about the clinical trials thoughts here and how that, because you have applied those thoughts so many times in different instances, and I think it'll be a little bit of insight from him as well.
Yeah, Jed, go for it. I think that would be wonderful.
Yeah, so when we evaluate new areas to get into, part of the consideration is how much is our R&D expense going to be. So what we would like to do is benchmark whatever investment we make in a particular disease indication for what has previously been done for that indication. So knowing the number of studies that one might expect to have to conduct to get from IND to registration, how big are those studies? Do they tend to be multinational studies? What kind of comparators are being used? What kind of endpoints? All these contribute to time and money. Are the trials, they 6 months, or are they 2 years? Are they 30 patients, or are they 300 or 3,000 patients? So being able to take a snapshot of what the environment has been in the past can give us a basis for some assumptions for how much companies will need to invest to bring a product to market. So even the various stages of development, phase 1, phase 2, phase 3, how many studies are we talking about? So I think being able to quickly survey the landscape and look at historical data, including recently historical data or ongoing data, puts us in a much better position to estimate what our development costs might be and how long we might expect a typical development program to take for a certain indication. So when you're weighing different indications, obviously those that will read out sooner, that cost less, will give you a faster return on your investment. So those kind of decisions, can be aided with information like the Catailyst system.
Thanks, Jerry, and thank you, Jet. And understanding, how big the market is for the product, what is the business model and making money? Can you dive in a little bit with that?
Sure, absolutely. So as I said, we have 2 products right now, and we give access to the database, and the database has different types of information. It could be information about the company, what's going on in the company, how much money the company raised, whom did they partner with, what are the clinical trials they're doing. All these detailed information is well structured. So we give a SaaS subscription-based access to this platform, monthly subscription fees associated with that. And on top of that, we provide a daily alert. A customer can choose whether they want daily or weekly or a monthly alert or what's happening. because of the automation and our proprietary extractive AI, a lot of these data are 95% ready to be given to the customers. So they can easily choose a subset of this data, which is given to them in form of the alert. So those are the two things we provide as a SaaS model. What's coming up next would be a la carte utilizations and reports in continued other products. They will have SaaS model as well. So it's a recurring revenue model.
Yeah, and Chip, when we first met, that was what fascinated me about the business, but also the opportunity for growth, and really creating that kind of rinse and repeat model in the different areas. Obviously, starting with life science. And when you think about, we've had two questions come in for this. The competition. What sets you versus your competition apart?
I think Steve can come in and talk about it as well. I think most important thing about is being able to integrate more information in a single platform because of the automation. And second, replacing that human repetitive labor to accumulate the information. So it gives us in a very advantageous position for pricing, and then also making flexible for the customers to utilize that data. Steve, you want to add on to that, please?
Yeah, there's a few things. One is if you're an expert in a field, say, and you're already using basically Google searches to go to the clinicaltrials.gov or whatever, you have a sense of what you want very quickly. But some of these documents are dozens, if not hundreds of pages long, even, the 10Ks and 8Ks. I know where to find information on public companies in their registered documents. But when it's 150 pages long and you're looking for one specific sentence, and that sentence could be 15 different ways it's written, find out when the next milestone is or how many patients were in a trial, it's a lot of manual work to figure that out. You could set up on a platter here, even in things where you know to find them. The other is when you don't know a lot about a space, this is because it's sampling everything in the field, but only returning things that you've filtered down to be relevant to your search. You find little nuggets you were unaware of. Maybe in Jerry's field, an orphan disease you hadn't even heard of because it's so rare. But it turns out the clinical trial would be 10 people. There are little nuggets that arise simply because the information is being fed to you very quickly in an automated way. And I'll make another comment is so many small companies in the life sciences space and so many small venture and investor funds or family offices are doing diligence to place their money, as Jerry said, in the best places with the most meaningful return on a short timeline. You can feel very confident following what everybody else has done. But that's also a very crowded space. So the ability to see who's done it the best and how they've done it and what it's worth in dollars, because you're also able to link clinical trials fundamentally licensing deals that are in the public domain. You actually get information that provides a deeper sense of value or even finds the Achilles heel of a bad opportunity or a bad deal that you didn't know about. And the alert functions let you know when your competitors are doing something wrong. And we've also found an opportunity for a lot of vendors in the industry, lawyers and accountants who provide services to all of the biotech industry, but they have no idea what the companies are doing or when they've actually had a big milestone. In this way, we've actually been showing the product to some of these vendors and they love it. They don't do drug development, but all of their clients do. And so now they can speak more knowledgeably. They can actually provide better service without having to be curious about what on earth does this company do, right at their fingertips.
So I'll close it out with saying, what is the actual competitive advantage? We can read what companies are announcing without human intervention. So basically, if a company comes out and said they started clinical trials or they said they raised capital, our our bots, our training system, can read it and recognize that, categorize that, and extract further information as needed. That's number one. That's an event specific announcement. Second thing we can do, we can go inside a large document such as 10K, as Steve talked about, and we can bring in a specific sentence that is relevant. For example, cash positions. In a snapshot, within 10 minutes, we can tell what is the last cash position announced by 200 companies, 300 companies. If we think about manually doing that, it will take a lot of time. And the other things like knowing what is the future timeline. This is our powerful extractive artificial intelligence, which brings out the sentence which is relevant.
Thanks, Jed, and thank you, Steve, for talking about that. And I think it's important, for folks as they look at, okay, where's the company going, thinking about investing, what the competitors are, the differentiators. So really appreciate you diving in there. Jed, one of the things when we first spoke was just, kind of how quickly you guys are moving. Can you talk about the progress that, let's just say, you've made from Q3 of last year to today?
Sure. So most important thing was getting this product in front of the customers and having a quick feedback, right? So from last year when we launched the early part of the program, we made sure we gave it to a handful of 10, 15 companies and get their feedback. And as we got the feedback, we made sure we changed those, and now we're ready. So that's the most important thing we learned from them, and they said few things needed to be changed, and we did that. Second important part, as we're getting into this, we didn't have any money. If we look at last quarter, last year, right? We did not raise any capital. We efficiently managed the company. Right now, we are in a position to do the actual product launch. And we also diligently work there to make sure we're not burning cash every day. We did a very nice partnership with Launchit Venture, which is preserving our cash, but they're making sure that we're out there knocking on every single door. We became MassBio member earlier this year. Since January, I have been to 5 different conferences. I have a lot of follow-up remaining from that. We're sponsoring an event in Ontario next month. In the month of August, we're going to get featured in MassBio in October. So there are a lot of exciting things that are happening, and we're constantly talking to the customers.
Really appreciate that. And I was going to parlay the last question with that. And you talked about a couple of exciting milestones that are coming up between August and the fall. Any others that you want to mention between now and the end of the year that you think are really going to be a nice springboard and launch point for the company to continue to grow?
Yeah, so we have several things, additional features we want to integrate to the platform. One of them is visualization. We do have some preliminary visualization, but we're thinking either building it ourselves from scratch or integrating with Tableau or Power BI. And that's one of the important immediate milestone. We have one of our part-time employee, student intern from Northeastern coming in next month, and she's going to spearhead on that. She has a lot of experience in that field. Other thing, you also look into lots of data analytics and automate a report so that we can sell reports one time instead of a recurring subscription model. We're working on that as well. I'm talking to NASDAQ next week to figure out how do you bring in the stock market data quickly. And then we also have the plans for clinical trials analytics integration. There are a lot of different things at stage. It will depend how quickly we can raise the appropriate capital. It will depend on how quickly we can put together a team to get all those things done.
Just hearing you speak, and I've thought this from the moment I met you. When do you sleep? There's so much going on here, and there's so many moving parts. I'm so impressed by you and Steve, you and Jerry as advisors. But Jet, you're unbelievable.
You can ask Steve. Steve can answer you that when do I sleep.
That brings it very late hours. So, Jet, he's unbelievably attentive to his spend. We don't spend a penny needlessly ever. Interestingly, one thing he did mention, which I would like to highlight, is we've formed a partnership with a group called Launch It. They're Canadian based, but they've actually are a sales channel for health IT platforms. And one of the guys who runs is a very close friend of him for many years. He actually worked for the largest competitor in our space in his last job. When we showed him the head-to-head of the two products, and he knew he had 11,000 employees, and we had probably 11, he quit his job and said, I'm going to form a partnership with you guys because I already have these friends who are running this Launch It. And he says, I know every single way that these products can be used in the space, and I can help you. So we don't have a lot of sales now because we've been a lean team perfecting the product, but as soon as people get their hands on it, which Justin did, they'll see the power of it, and now it's going to save them time and money. And we have a very attractive starting price point compared to any other vendor in the space.
Yeah, partly of it, many people don't know what we have. We have been hiding it for many, many years. We have been very, very cautious of showcasing what we have. So that's one of the reasons why it's so slow, because they don't have any idea that, like, I'll give you another example of the utility of this platform. I often see in the LinkedIn, somebody put together a list of 100 companies on a particular topic. My question to them, how do you follow it? You don't have a tools to follow that automatically. We're already doing for a service company right now. We're following 100 companies on a daily basis. And they're just going to do a trial run with us. And we can know every single thing in the life science space they are doing, whether they're starting a trial, they're making an announcements, anything they do.
We're also seeing announcements from new companies that are taking advantage of the AI and the GPT to address the market opportunity. The market opportunity is not invisible, but we have a 4-year head start on them with 12 full-time people working on the platform, plus industry experts from banking to drug development who created the platform. There's a very big difference of us compared to any other new startup.
Steve, really appreciate that. And Jit, thank you as well. We've covered a lot here, gentlemen. And, when we think of the future of the company, if we want to, maybe each person answer this individually, but why is now the time to invest in your business? I think, you could say, well, the last, 12, 13 questions, that's enough. But if we could just summarize it maybe in a couple minutes, why is now the time? You talked about, the exciting endeavors that you have going between now and the end of the year. 2024, the industry is only going to get bigger. But in your own words, if you could summarize it on why now is the time to invest.
Yeah, I'll go last. Jerry, Steve, if you please go ahead of me.
Well, first of all, Jerry and I became investors after we used the product. So we believe in it, first of all. Every time I recommend something to someone, they want to know if I invest, but I want to know if it works before I consider that. And why do we invest now? Because we know it works. We know it's useful. We're investing, not every startup I've been involved in, which I know is about over 60, there's a technology risk and a commercial risk. We're beyond the technology risk. That is out of the way completely. You're gambling. You're investing now at a time when it's only commercial risk. We have some great alliances lined up. We know we have a product that works because we've been through beta testing with everybody. So now's the time to jump on board. A year from now, we'll have revenue, but the way Jit runs his company is so tight-fisted with money, we're not going to waste a penny until we actually have the green light that we can grow very quickly.
Thank you, Steve. And Jerry, if you want to jump in.
Yeah, I'd say, as most people in the biotech industry know, this past year has been very difficult, with the loss of a lot of capital valuations. And with that, come hard decisions of, what people do you keep at companies, and how many projects do you work on, and yet you don't want to miss the next best thing coming along. So being able to have a really a cost-effective way to assimilate information that doesn't require, you know, a huge headcount, both from Catailyst end as well as from the end users end. I think it's one of these efficiencies that's going to, you know, pay itself back, you know, over and over again, to be able to continue to manage your business under a very tight budget. So again, I think information is the name of the game, but, you know, time is important as well. So being able to get access to as much information as is needed to make your decisions in as short a time as possible, you know, is going to be important in this current climate.
Yeah, I think thank you, Steve and JD, both of your thoughts. I think the time is now, because we need this acceleration inside Catailyst as well. 4 years ago, when I started this, nobody was thinking about AI. We put AI in our name because we want to accelerate drug discovery, and we wanted to use artificial intelligence. We are in a stage where we can very quickly integrate stock market data, clinical trials analytics, visualizations. All these things are more decorative than the actual backbone. As Steve said, the technical risk is very low. We already put together, we already know how to get all those data. We know how to understand those data. So now transforming that company from startup to a revenue generating company, we need the investment right away. So more we wait, it's going to be loss of time. I think that's exactly why they should jump in now.
No, really appreciate that, Steve, Jerry, and Jit. And, you know, people should know that, you know, the round's only going to be open for so long, and that the next round, most likely the valuation will go up. So if you are inclined to explore further, either right now or folks will be listening to this in the future, you can go to netcapital.com. And this is such an exciting space. And, you know, as we wrap up here, Jit, Steve, and Jerry, you know, explained your bios, everything that you're doing and working on while this business is continuing to form. I know how busy you are. Thank you so much for taking the time to be with us today, and thanks to everyone who took the opportunity to listen to Steve and Jerry, who are the advisors for the business, as well as Jit, their president and CEO. It's been unbelievable getting to know you guys and working together. And again, just thank you for your time today, and look forward to speaking soon. And thank you for everyone who tuned in.
So,
Thank you, everybody.
Thanks,
My
guys.
pleasure.
take care.